Over the weekend, we also met this face, 57-year-old Sheila Staton of West Dallas. This is the last picture of Sheila and her husband, Alan, who says, quote, "I'll miss her dearly. 32 years of marriage, 5 children, 17 grandchildren, and 1 great-grandson. We had a beautiful life." Sheila had a fever and cough, was hospitalized on the 19th, and died 6 days later. Of the 9 coronavirus deaths, many had underlying conditions such as diabetes or heart problems. But a glaring commonality is drawing attention from elected officials. All 9 are African American.
Studies have shown that Americans are suffering from a lack of vitamin D. And vitamin D deficiency is widespread in African Americans.
African Americans are in the United States, there's been studies, African Americans are severely deficient. They're 28 times more deficient in vitamin D than Caucasians.
Wow. You live above the 37th parallel in the winter, you don't make any vitamin D. So you have to, our relatives, you have to tell them to supplement.
That a lack of enough vitamin D may contribute to other illnesses and diseases, such as increased risk of death from cardiovascular disease, severe asthma in children, cancer, diabetes, rheumatoid arthritis, high blood pressure, and gum disease, all conditions that are especially common in African Americans.
I checked my blood level. Normal blood level should be between 35 and 50. My blood level was 9.
People who have the lowest levels are going to have the best effect from supplementation. And it cut their risk of respiratory infection, get this, in half.
African Americans, they have more melanin in the skin, so they absorb less UVB radiation and they don't make as much vitamin D per unit of time they're out in the sun. You're not going to get a lot of vitamin D in food. Not a lot. Again, not a lot in food. Okay? Glass of milk, 100 IUs. You can drink 20 glasses of milk.
Guess what? We're sunlight deprived. I guarantee you, every man in this room, if I check your blood level for vitamin D right now, if you're not on it, you're deficient. Everybody's doctor in here should be up on this. And if you're a person of color, I would say if you're white living in Maryland, you're probably vitamin D deficient too. So all of your doctors should have checked. And if they have not, the next time you see them, hey, can you check my vitamin D level? It is. Now, if you're taking a multivitamin tablet a day, how much vitamin D is in there? It's about 400 international units. The average African American needs 3,000 to 5,000 international units per day. It is very difficult to overdose on vitamin D, by the way. I take 5,000 a day, 5,000 international units a day. Okay, so what you're getting in a multivitamin is not enough.